Hello, I'm Dr. Rohini, one of the consultant reproductive medicine working in Vardhan Fertility Centre. Today I'm going to talk about the role of genital tuberculosis in infertility. So, there is a rapid increase of genital tuberculosis in infertility patients. It has been noticed that in Asian countries, the role of TB is around 25 to 30%. The problematic part is that most of these patients remain undiagnosed because compared to patients who have pulmonary tuberculosis or in whom the TB affects the lung, they have frank symptoms like fever, cough, and malaise, and they'll have loss of weight. That does not happen in women with genital tuberculosis. Most of these women remain asymptomatic. They have usually only 3-4 common symptoms. First of all, these women will be suffering from infertility. 75 to 80% of women with genital tuberculosis have infertility. Apart from that, they might have some menstrual irregularities, bleeding disorders, like they'll have very scanty bleeding or irregular bleeding, and they may have vague pain abdomen. So these symptoms do not give a very strong suspicion of tuberculosis. Usually the abdominal pain is so vague that the woman does not even go to the clinic to get it checked. But as it persists over a period of 1 year or something, the pain gradually increases and the woman goes and gets it checked up. When patients come with such vague symptoms is that, first of all, it's microbiological diagnosis or tissue diagnosis is the definitive diagnosis for tuberculosis. But then it's not possible that every time a woman comes into your clinic that you start testing her for tuberculosis, because such kind of tissue diagnosis requires invasive procedure, and also it's very expensive. So first of all, when woman comes to us, then we do an ultrasound. There are some frank features which we can catch in the ultrasound. First of all, most commonly genital tuberculosis affects the tubes. So when we do an ultrasound, we might find dilated tubes, which is a sign of tuberculosis infection. And sometimes on doing as like I told you, first it affects the tubes, then it affects the ovaries, and then it affects the uterus. So when we do ultrasound serial monitoring of the patient, we find that the endometrial thickness, that is the lining of the uterus, never comes up beyond 7 to 8 mm. That also gives us a very strong suspicion that the patient might have tuberculosis. So how does TB affect your fertility? Like I told you, first of all, it affects the fallopian tube. So it causes infection, dilatation. The tubes become enlarged and they become inflamed. So their capability to carry the egg from the ovary and transfer it to the uterus disrupted. And even if the tube is functioning well, there is a chance that the patient might end up having ectopic pregnancy. Ectopic pregnancy means that the pregnancy is not inside the womb, rather it is outside the womb, most commonly in the fallopian tube. Such kind of pregnancy cannot grow and it will cause rupture of the tube and cause threat to life in the woman. So this is how, as far as the tube is concerned, it's going to affect. Next, tuberculosis of the ovary. We have noted that it inhibits ovulation, that is the egg release of egg from the ovary, and it also reduces the quality of the egg which is released. And next, it affects the uterus. In case of uterus, it destroys the endometrial lining of the womb, and it causes a lot of adhesions, and thus it makes it uninhabitable for the baby to grow. So this is how it affects your fertility. So now, once that we have seen the patient, we have followed her up, we have on scan, we feel that we suspect that patient might be having tuberculosis. So the next step would be to do a confirmatory test. For that, we would be taking tissue diagnosis, that we would be doing a procedure called endometrial biopsy, or we would be doing hysteroscopy, where we would be putting a scope directly into the uterus and directly see how is the lining and take a tissue for biopsy and send it for tubercular PCR testing. And other than that, we can also do a diagnostic histolaparoscopy, because in hysteroscopy and ultrasound, on ultrasound we would be seeing only a two-dimensional image of the uterus and ovaries and tubes. And when we do in hysteroscopy, we'll be just having a look inside the uterus. But what about the tubes and ovaries? So for that, we would be it's advisable to undergo histolaparoscopy, where we would be having a thorough look at the tubes and the ovary, and we can take any suspicious tissue for biopsy, and we would send it for tuberculosis testing. So what happens once that the report comes as positive? So in that case, we would be starting you on treatment for 6 to 9 months of anti-tuberculosis treatment, and then we would be following you up again. Before the advent of IVF and frozen embryo transfer, the chances of conceiving after tuberculosis was almost nil. Even after such latest procedures, unfortunately, the success is still 15 to 20%. I hope that few of your doubts are clear today. In case if you have any further doubts, or if you feel you have some of these symptoms of abnormal bleeding, pain abdomen, or in case if you have history of past tuberculosis and you're still finding it difficult to conceive, maybe you should come to us for testing. For further doubts, please reach our website and you can come to our clinic directly. Thank you.